Hi, this is Dr. Arpitansu, and today we will talk about the nephropathies. Okay, in this video we will talk about the IgA nephropathy, and in the successive video we will talk about the diabetic nephropathy, atherosclerotic nephropathy. Okay, then HIVAN, that the HIV associated nephropathy, and in the end we will talk about the interstitial nephropathy. Okay, so in this video we will mainly focus on the nephropathy, that IgA nephropathy, that is the glomerulonephritis. So let's begin. So let's begin with the IgA nephropathy. Now, first, before studying about any type of nephropathy, we should understand what is the meaning of nephropathy. Okay, so any kind of disease which are related to the kidney can be termed medically as nephropathy. So all the renal disorders are medically called as the nephropathy. So let's begin. Now, Berger first described about the glomerulonephritis, and now we call it as the IgA nephropathy. And these are characterized by the episodic hematuria. So what is hematuria? Hematuria is the presence of blood, that is the RBC, in your urine. If there is a presence of more than 5 RBC cells in your urine, it is called as the hematuria. And in the IgA nephropathy, there is a recurrent episodic hematuria. Okay, and it is also associated with the deposition of IgA in the mesenterium. So what is mesenterium? First, we should know about what is mesenterium. The word mesenterium is made up of two words, meso and anges. Meso means in the middle and anges means the capillaries. So mesenterium is actually a space in your glomerulus or the Bowman capsule, not in the Bowman capsule, it is a space between your glomerulus, okay, which is continuous with the smooth muscle of the arterioles and surrounded by the capillaries. And it mainly contains the intraglomerular mesangial cells, which are the pericytes and help in the regulation of filtration. Okay, so this was the mesangium. Now in the next slide we will see a diagram. Okay, so in this diagram you see that this is the afferent arteriole, this is the efferent arteriole. Okay, these are the glomerular capillary lumens over here, and this over here is the Bowman's capsule. Okay, this is the lumen of the Bowman's capsule, which is continuous with the PCT, okay, proximal convoluted tubule, and this is the in between the glomerular capillary lumen and the afferent and efferent arteriole lumen. You will see these purplish colored cells. These are called as the mesangial cells. Okay, and in these mesangial cells there is deposition of IgA, which causes the nephropathy called as the IgA nephropathy. Now by definition we know that these mesangial cells are continuous with the smooth muscles of the arteriole and surrounded by the capillaries. So you will see these mesangial cells are on the both sides surrounded by these capillaries, afferent efferent arterioles and glomerular capillaries. Okay, and it is outside the lumen. Okay, and it help in the regulation of filtration. Okay, so these are the mesangial cells. Now before going further, we should also know that there are some other diseases in which there is a deposition of IgA. These are like IgA vasculitis or HSP, called as the Henoch-Schönlein purpura. Okay, let's go further. Now we should know about the epidemiology of the nephropathy, this IgA nephropathy. Now there is a male preponderance of this IgA nephropathy, and there is a peak incidence of the secondary and third decades of the life. Okay, now there is a 30% prevalence along with the Asian and Pacific rim, and 20% in the southern Europe, compared to the much lower prevalence in the northern Europe and North America. Now it is a predominantly sporadic disease. Sporadic disease means that it is a scattered disease or it occurs occasionally. Okay, so IgA is not a common disease. It occurs occasionally and irregularly in the population. Familiar forms of IgA nephropathy are more common in the northern Italy and eastern Kentucky. Now we will briefly summarize the IgA nephropathy in a definition and try to explain it. Okay, so this IgA nephropathy is an immune complex mediated glomerulonephritis and defined by the presence of diffuse mesangial IgA deposit, often associated with the hypercellularity. So IgA nephropathy, obviously, because it is related to the IgA, which is the immunoglobulin A, it is known as the IgA nephropathy. And it is defined by what? It is defined by the diffuse mesangial IgA deposit. We have seen that in this disease, the IgA get deposited into the mesangial cells. Okay, the mesangial cells which was present between the capillaries of the glomerulus. Okay, and there's not only the deposition of IgA deposits, IgA. Along with the IgA, there are sometimes deposition of also C3 and sometimes other immunoglobulins like IgG, IgM and propedrin. Okay, and in the microscopy you will see that there is a hypercellularity and increased extracellular protein deposition. Now let's move further. Now in the clinical features, what was the first clinical feature that we saw in the definition? We saw that the IgA nephropathy was characterized by the episodic hematuria. Okay, so episodic hematuria is the clinical main feature of this IgA nephropathy. So there's a recurrent episode of the macroscopic hematuria, which is followed by the upper respiratory tract infection. Now remember that after the recurrent episodes of the macroscopic hematuria, it is followed by the upper respiratory tract infection. And because it is followed by the upper respiratory tract infection, IgA nephropathy is also called the synpharyngitic nephropathy. Okay, so synpharyngitic nephropathy, the other name of the IgA nephropathy, is because in it is present it presents the upper respiratory tract infection. Okay, now there is a proteinuria. Proteinuria not always present. Okay, it appears late, and there's also a persistent asymptomatic microscopic hematuria. So what is microscopic hematuria? Okay, so before going further, what is microscopic hematuria? We see that macroscopic hematuria and there's a microscopic hematuria. Macroscopic hematuria has a more amount of blood cells, RBC, in the urine, and it changes the color of your urine. Your urine may look like a cola color. Okay, but in the microscopic uh, hematuria, there are blood cells present, but in less quantity, and it doesn't change the color of your color of your urine. Okay, okay. Sometimes, rarely, that is less than 5% of the cases, there is also the presence of nephrotic syndrome. Okay, and it is present with the loin pain. Now let's move further. Now we will see about the membranous glomerulonephritis or the membranous nephropathy. So membranous glomerulonephritis, also called as the MGN, it is also known as the membranous nephropathy. Okay, and it accounts for more than 30% of the nephrotic syndrome, and it occurs in the middle age like 30 to 50 years of the patient. So it is rare in childhood, but most common cause of the nephrotic syndrome in elderly. By elderly we mean the age range of 30 to 50 years. Okay, and in the 25% to 30% of the MGN, it is associated with the malignancy, like solid tumors of lung, breast, or colon, or infections like hepatitis B, malaria, or rheumatological disorders like the lupus. Okay, SLE, we can call it as SLE, or rarely rheumatoid arthritis. So thank you. In the next video, we will meet again with the diabetic nephropathy. Thank you.